Hello and good morning, good Friday morning. This is Yvonne from Insurance Advisors Direct, along with Connie from Priority Health. We are here to go ahead and talk a little bit about the DSNP plan. So if you have any questions, please raise your hand or click in the chat box and we will go ahead and answer them accordingly. If you have additional questions, you can always reach out to me. My number is 248-946-4640, extension 124, or Connie, and we'll have her contact information in the slides. Again, if you have any questions, just raise your hand. Hopefully all you guys are enjoying your Friday, getting excited for this AEP. And with that, Connie, did you want to go ahead and start?
I'm happy to start. So guys, as Yvonne said, so we had a little technical difficulty, so I can't see your questions. But if you put those questions in the chat, Yvonne and I are going to work on that. I think I might be able to see that. I see we've got we got 6 agents now. So I'm going to go over, I actually talked to the creator of our DSNP. Her name is Lana. And I can't even tell you her last name, but she is the sweetest thing. So I did run through a couple questions I had because we just got this deeper dive a couple days ago. And so I wanted to talk to our DSNP director and get some answers to this. So if we have questions, hopefully I can get those taken care of. So we're going to go over the DSNP, our 2022, and it's just a plan. We only have a single DSNP, the model of care, and that is what sets the DSNPs apart from the others. Is every carrier has to submit to CMS what their model of care is. So we're going to go over all of that if I can get my, okay. So if you are currently working with that DSNP population, I'm sure this is not going to be news to you. But the DSNP population is one of our most vulnerable. They are with priority, they have to be a full dual benefit beneficiary, which means they've got full Medicare and full Medicaid, no spend downs on the DSNP plan. We do have an option for those people with a spend down, and that would probably be our zero premium plan. Most of those dual eligibles fall into one of these categories. So they're elderly and disabled. They have severe behavioral health needs, intellectual or developmental disabilities, or certain diseases. If those diseases are such that they will cause them to have low income or be Medicaid supported. And not only are they vulnerable, but they do have that, they're a complex population. So if you do work in this population, you probably already know this, but typically, so more than half, and actually they say 48%, but my case managers say more than half have 7 or more chronic conditions. And you'll see 31% take 7 or more prescriptions. I'm told by the case managers, the average is 15. 45% of them have a mental health illness. And it says out here, not mood disorder. So it's not somebody that's just blue and down in the dumps. They actually have a mental health illness. And 13% are in a long-term care facility. And a lot of that is because the family can't take care of them, versus 1% of our average Medicare Advantage members. So for Priority Health, and we may have a little bit different eligibility than some of the other carriers, they only have to live in the lower peninsula. So they have to be enrolled in both A and B. And as I mentioned before, it has to be a full Medicaid. So they're going to be a Quimby Plus or a Slim B Plus. All of that creates that full benefit dual eligible, the FBDE. With us, they do have to be 21 years of age or older. I think some of the carriers maybe take them at 18. So you guys already know this. A DSNP plan means the member pays 0. The carriers are not, the providers are not allowed to balance bill. So if your member goes and they present both cards, so with Priority, it's 2 cards. It's the Priority card and it's their green Medicare service card. If they present both of those cards and the provider accepts them, they cannot balance bill. It is against the law. I've even got some background for you guys if you need that when you're working with them. Okay, So DSNP is the primary coverage. So the Medicare portion is going to be the primary care. So when your members go and seek care, they're going to present both cards. Remember, the Priority Health Medicare card and then that Medicaid card. Medicare is billed first. The member is going to get an explanation of benefits for that Medicare claim, and then Medicaid pays secondary. So what have we added new and improved for 2022? Let me tell you, we're pretty geeked about the fact that, you know, this is our second year. You told us some of the things that we were missing compared to our other carriers. And so we have worked very hard to beef that up. So one of the things that we've added this year is transportation. That was one of the things that, you know, they have the transportation still through Medicaid. So I want to talk about that this year, they're going to have medication 3 different ways with Priority Health. They're going to have the new transportation that we're putting on, which is actually through Safe Ride. And I've got a slide coming up on that. They have got still the Medicaid transportation, which may be good, may not be good. And then they're also going to have the Papa Care, and we're going to talk about that. The OTC limit for this year is going to be $150 per quarter. And I know you're going to tell me the other carriers have X amount. What we're finding is less than 10% of the members ever utilize their full amount. 40% never even use their OTC benefits. So it may look great that we've got those big shiny benefits of $350 or more on that quarterly OTC. And the interesting fact is the OTC benefit that is used the most, or I should say what they consistently use, is going to be for those adult diapers or those Depends. Meals, this year we are adding on all of our Medicare Advantage plans, 28 meals post inpatient. So they do have to be inpatient for whatever reason, whether it is hospitalization, whether it's behavioral health or mental health facilities, but they will get those meals, and that is through Mom's Meals. The personal emergency response system, I think CMS was pretty much pushing this one because I think all of us carriers now have that. And then I'm going to talk a little bit about the differences between those. Pharmacy benefits, again, because these members take so many prescription drugs, we wanted to say that all of them, whether they're a LIS level 1, 2, or 3, they're all going to have a 0 copay for their tier 1 preferred generics. The dental, that was one of the things that I got beaten up pretty good by you guys on. So we've increased our preventive, but we're adding that $2,000 worth of comprehensive coverage, including bridges and dentures. And then remember too, that dental with us is through the Delta Dental PPO. So they're going to be able to use non-Medicaid dentists, but remember, they still have the Medicaid benefit as well. So they can double dip on that. We're going to talk a little bit more about the PAPA, and then of course the hearing through True Hearing. The transportation. So that's what I had said. It's going to be offered through Safe Ride. Safe Ride is when we were looking at the different benefits and that sort of thing that the other carriers provide. Some of those are considered curb to curb. Safe Ride is promising us that they're going to give the members a white glove experience, and it is doorstep to doorstep. So if some of your members have like some disabilities, some walking issues, it's not going to be a car that just shows up in their driveway. They're going to get them at the door and they're going to deliver them to where they're going. We are also going to, if there's not a lot of Safe Ride providers in that area, we are also going to coordinate with Lyft and Uber to make sure that not only does your member get delivered to where they need to go as far as that doctor's office, clinic, whatever, that they're going to get picked back up. And I happen to know this one for a fact as far as I took my mom to the doctor about a month ago, and there was a lady sitting in the waiting room. And my mother walked up to her like she knew her, and she goes, "Well, what are you doing here?" And she said, "Well, I'm done with the doctor." She said, "But I'm just going to wait for my ride to pick me up." She had brought her lunch and a bottle of water because she said it could be 1, 2, or 3 hours before she gets picked up again. And that's one of the things when I was talking with our DSNP director. She said that is just one of the things that we don't want to happen with our members. So through Safe Ride, we're going to have 30 one-way trips to and from health related. So it's got to be health related. Our OTC I already talked about is that $150 per quarter. All members, so all of our MAPD members are going to receive a new 22 OTC card. But remember, if they are a current member, their existing over-the-counter card will work until they get that new one, because they generally don't get that until about the second or third week in January if they're coming new to us for 1/1. And then, of course, we have that healthy savings discounts. And the nice thing is this year we are adding that 800 number where your member can call. You can kind of see it a little bit. Let me see if I can get the pen here. You can kind of see it right here. That healthy benefits where they can call on the back of their card, that phone number, to find out what are the foods this week that have that healthy discount. So it's kind of like that Kroger card where you've got discounts every week. So it might be $1 off a pound of navel oranges, or it might be $1.50 off a 12-ounce container of Chobani this week, but it might be off Stonyfield next week. So the members can actually call that 800 number and find out what is this week's. They also have the ability to do it online, but a lot of our DSNP members are not really computer literate and or don't have the access to the internet. So as I mentioned before, that post-discharge meals is through Mom's Meals. So they have to be discharged from an acute facility. It can just be a 1 day. It doesn't have that 3-day maximum that some of them do. So the acute hospital, a psychiatric hospital, or a skilled nursing facility. And my mother actually used, we didn't have it through her insurance company, but when I had her, she was discharged from the hospital this January. I called Mom's Meals, and if you've not seen how they work, they actually have different dietary restrictions. So if somebody needs to be low salt or heart healthy or diabetic, they have meals that they can order that are in that category. However, no one's going to tell them what they have to order. So this is on all of our DSNP members and our regular individual plans. So that personal emergency response, we chose the critical signal technologies this year. And the reason for that is there are some carriers out there that have that PERS, but if they happen to be Wi-Fi, then your member has to have Wi-Fi. And also once they walk out of the house and they fall, they're not going to get picked up. So that PERS or that, help, I've fallen and I can't get up, isn't going to work at all. So critical signal technologies is using cellular service. Now, your member doesn't have to have a cell phone. They don't have to have a telephone itself. The cell service is built into that actual device, and that device can be worn as a necklace, or they also have the option of wearing it as on a wristband. So everyone that is a DSNP is going to be eligible. Now the care manager is going to coordinate the PERS devices, along with giving them a fall risk assessment. And that's all done. Every DSNP member is supposed to have an individual care plan assessment as far as knowing how much care they're going to need. Do they need in-home visitation, that sort of thing. Okay, so as I mentioned before, all of the plans, and I'm not sure if you can see this, all of our plans, so whether it's an LIS 1, 2, or 3, is going to have a 0 copay on that tier 1 drug, where like LIS 1 would normally pay $3.95 for those tier 1 drugs. And one of the things that we have changed this year is if your member is getting a 90-day supply, they're going to get that for 1 LIS copay. So let's say you have someone in that LIS 2 and they're getting a tier 3, 4, or 5 drug. They're going to pay $4 for a 90-day supply if they use Express Scripts. So again, they're vulnerable members, and we're trying to make it as easy as possible for them to get the care they need without breaking the bank. So the dental coverage, I should hear some yahoos if your speakers were open. This is one of the things that you told us we really were lacking on. So for 2022, they're going to have that one fluoride treatment extra, instead of just those bite wing x-rays, they're going to get that full mouth series, 100%. You already know they can't have a copay for fillings, crown repair, extractions, bridges and dentures. So we're going to pay for those bridges and dentures once every 5 years. And then of course the relines and the repairs to the bridges. So let's talk about, let me get it to move. These preventive services that are here on the left do not go towards that $2,000. So the 2 oral exams, the 2 cleanings, the brush biopsy, the fluoride treatment, and I think you guys are going to notice that on our other plans, our other Medicare Advantage plans, we've added that fluoride treatment. I don't know if it's the American Dental Association is now saying that seniors should have fluoride treatments. They're going to get that one set of bite wing x-rays every year, but then that panoramic x-ray every 24 months. So what's under that $2,000? It's going to be the fillings and crown repair, the simple extractions, bridges and dentures once every 5 years, the relines and the repairs, and then it's got a $2,000 annual plan maximum. That's if they are using the Priority Health Delta Dental PPO dentists. Remember, they still have that private fee-for-service Medicaid plan, and they can continue to use. So if they needed more additional service, or maybe they wanted to use their extractions under the Medicaid portion and get their dentures from us using a PPO dentist, I mean, they've got some options now. The Papa Care, this is one of the things that we have helped expand. So our members have still the 8 hours, but they are going to, you can see on here that they're proactively identifying and asking members what they need to have with their health plan. So do they need to coordinate? Do they need to find a doctor? We're going to actually make sure that if they don't understand, did they get a bill that they shouldn't have gotten? You know, some of these people are very upset about that. So this is that third way. As I mentioned before, we're going to have transportation 3 ways. We've got the Safe Ride. We've got what the state provides them depending on where they live. And then the Papa Care. If they want to use their 8 hours per month, they can have unlimited distance on the transportation, but it is based on their 8 hours. We're going to continue to use True Hearing for our hearing. So of course, you know, it's already a 0 copay for the hearing exam, a 0 copay for the 2 advanced hearing aids. And last year it wasn't realized that some of those hearing aids have a mold that has to be done. So we want to make sure that the members know they don't have to pay for that. We've expanded how long that trial period is. So maybe they're trying to decide which advanced hearing aid works better for them. So they try it for 50 days, whatever. They go back in and say, this one isn't working as well. And they've increased the amount of batteries as well, because for one, the members don't need to be purchasing batteries with their limited income. So DSNP, this guy shouldn't be any shock to any of you. We've already talked about the dental, and it is the Delta Dental PPO network. We've beefed up the OTC, the pharmacy. We have improved that tier 1 drugs, the Papa Care, the meals, the transportation we've added. So now they have it 3 ways. And then they've got that PERS. Okay, chiropractic is exactly the same. They've got those 24 visits maximum on that. And then they do get that 1 x-ray. So everything's a 0 copay. They get 1 exam, 1 retinal imaging, and a $200 allowance towards their eyewear. And it says no out-of-network benefits. So they are going to have to use one of our providers, and that is through VSP. I'm sorry, I had a brain fart there. So Brain HQ, this is a wonderful benefit, but if your members don't have internet, they're not going to be able to use that. They're going to have 20 Medicare covered sessions on the acupuncture if they want to use that. And the way that works is they get 12. If there is an improvement, then Medicare will give them the additional 8, but they also have 6 for the non-Medicare. What Medicare covers, it has to have the diagnosis code of chronic lower back pain. So the 6 non-covered could be things for migraines, it could be stress, it could be different aches, pains, someplace other than chronic lower back pain. So the fitness is going to be, again, through sober sneakers. And of course, the My Strength is using internet as well. So the model of care, as I mentioned before, this is one of the things, if I can, it will not advance. Okay, there we go. Model of care. This is one of the things that all of us DSNP carriers are judged on. So we have to meet certain criteria, and Priority Health is very proud of the fact that we have exceeded all of those. So one of the things that we are looking for is we have to take a look at our DSNP population, the care coordination. We want to make sure that every one of those has what they need. Our provider network, there is no larger network than ours, because you guys know every provider that's in our regular Medicare Advantage is also in our DSNP. They do have the ability, so they would have to provide that Medicare, their priority card and their Medicaid card. And then of course, each doctor and the member and we ourselves are judged on those improvements in the health of those members. So each member has to have a completed health risk assessment. And I know this is going to be one of the questions, and guys, as of today, I have to tell you, we are not incentivizing the agent to do those health risk assessments. We actually have a care manager assigned to each one, and we have been using some of the boots on the streets to get these things. So, but stay tuned. We're taking one more hit at that whole reimbursing agents today. So each plan, each member gets an individual care plan. Once they have that individual care plan, they are assigned a case management team. So they may actually hear from, let's say, the clerk, if it's just checking on drugs, that sort of thing. They may be talked to by we have the case managers, we have assistant case managers, we have RNs, LPNs. So depending on what that member needs is how often we're going to actually contact them. And we're working on that quality improvement plan for that particular member. So each member, our goal is to improve their health outcomes. So one of the things that is tough with this whole group is some of them are not looking to improve their health status. They want to do what they want to do, and they don't want a whole lot of input. But we do try to find them physicians and specialists to help support them. We want to make sure that we're coordinating the care, because sometimes they're seeing getting a behavioral health doctor and their PCP, and they're not seeing the differences. So drugs are being prescribed that the other one doesn't know about it. So that is one of our challenges, and that's one of the things that that interdisciplinary team is working on. So as I mentioned before, that interdisciplinary team, they are going to be those care managers. We use a lot of community-based providers. These are the people that will go out on the street, make sure that our members are being taken care of. If one of our members has a particular drug that's a life-sustaining drug, we're going to have a timer based on that. And if that member doesn't get that drug, let's say it's a specific heart medication, and they were supposed to get it filled on Wednesday, there's going to be a flag that comes up, and today someone's going to reach out to them and say, hey, Mrs. Smith, what happened with your drug XYZ? Did you get that filled? What happened? She may say, I went to the doctor and I got, a 10-day sample. They're going to reset that time clock on that. She may say, I am sick in bed and I can't get out to get that drug. Then we're going to make sure that we have that actually delivered to her. So that is one of the things that we're watching these members extra carefully to make sure that they're getting the needs and the care they need. Okay, so every year we contact with approximately 94% of our population. And that's not just that health risk assessment. I can't talk today. But that is the whole disciplinary team trying to figure out what does this member need. So 88% of our health risk assessments are completed. These that population resists having people come in their home, resists answering questions. There is a lot of challenges with getting these done, but 89% of our members have either completed that ICEP. They've it might be face-to-face. We might be using community partners to do this. But you can see 89% of our members have completed that. And 1 in 4 members has actually had a face-to-face visit with someone in their case management team. So these, and you can see them. I was talking to our director. We've got a couple more that are pretty impressive, but this is what they just pulled together quickly for us. You know, one of our developmentally delayed members used to see the emergency room 23 times in 6 months. So the care manager said, what's going on? Why is this? So what they did is they had one of the case management health workers contact this person, because what it looked like is that they were, it was loneliness. So on Fridays, they were contacting this person and getting them checked in, and you'll see right there, it says within 6 weeks, the care manager was able to get this member the resources he needed, so people to visit with him, and they reduced his, and it doesn't give an amount here, but Lana told me today, it's like it was reduced to 1/3, so it was reduced by 2/3. And then also one of our case managers found out that we had a deaf DSNP member, and she was very, very concerned about a house fire. And so they were able to get a partner, a community partner, to actually install this strobe fire alarm, and to keep her, and she has small children, to keep them all safe. So it's a great thing. We also, I found out today when I was talking to her, there are also, besides the strobes, she just happened to be deaf, but they also have what they're called bed shakers. So if they happen to be on a lot of drugs and maybe they do sleep too soundly, they're not only deaf, but they have some other issues. They do have the bed shakers available too that they get on these members' beds. So how do you know if they're going to be eligible for Priority Health? I think you guys have already done this, but you're going to call that 800 number is our regular customer service number. Option 2 takes you to Medicare. And so you're going to our broker customer service. Option 2 takes you to Medicare. And then if you have the member's first and last name, their Medicaid number, their Medicare number, their MBI number, we can tell you if they are a full benefit dual eligible. And please note that we get that Medicaid eligibility from the state of Michigan. So that means if you were to call today, they're going to be able to tell you that that member qualifies for the month of October. We can't tell you what's going to happen in November. So I do want to just make sure that we make that clear, is the state of Michigan only gives us the current level. And the LIS, remember, low income subsidy or extra help comes from the federal government. And so based on that, we can, if you're going to have to give us their Medicare number, and then we can actually determine what their LIS level is. So we have a lot of preferred durable medical equipment providers, and the biggie is diabetes. So many of these members have a huge, there's just so many of them that are on the diabetic supplies, and it might not be just the, it's the meters, it's some of those transderm patches, it's that sort of thing. So we want to make sure that they are delivered directly to them. And so we have a number of suppliers. There's a lot of times they've had experience with one provider and they do or they don't like them. So we want to make sure that they're getting their preferred out of our preferred providers. In-home health assessments, the same as our regular Medicare Advantage plans. We work with Signify Health, and that is where one of their LPNs, licensed nurse practitioners, we've got a couple different clinicians that can go in and do that checkup. What we have found is that in more than 20%, we can find some undiagnosed issues for these people and hopefully get them to their PCP and get some better care for them. Agent tools. I don't know if any of you have used this. I'm hoping if you haven't, we can talk about this. I don't know that this is actually going to be the best thing for the DSNP members, but it is certainly a phenomenal benefit on our regular Medicare Advantage, because the member has to have access to a computer. But if you wanted to, you could have talked to them, you can send them your link, and they would actually just enroll online. Now, the nice thing is you get a confirmation number as well, so you would know if that happened. And if any of you want information on this, it is on our Agent Tool Center, but I would be our Agent Center under the Agent Toolkit. I want to be able to walk you through this. This is a wonderful thing. Every now and then we have agents that forget to mark their broker number in when they're completing those applications. So you can use your own partner link. You can put it on your website. That way, if somebody signs up, you can talk to them. This would act as a wet signature on the application. We do have different ways, and I think that's coming up on the next slide. We have some approved materials. This one right here, let's see if I can get this one right here, that's considered a sell sheet. That's the 2022 is already loaded on our Agent Center. It is, so when you go to the Agent Center and you go to MAPD and you go to, then the toolkit, Agent Toolkit will pop up. And then you go down to pre-enrollment, and at the very bottom is all of the sell sheets. And so you can load that. We have some of these other things too, if you are interested in them. Please give me a call. I'm going to give you my name and number right now. So if you are in Southeast Michigan, even if you're not, give me a call. My number is 810-691-6831. Or if you prefer to email me, it is Connie, CONNIE, period, or dot, Elkins, ELKINS, at priorityhealth.com. And my number is 810-691-6831. Okay, guys, so this is the agent tool. So as I mentioned before, the DSNP cell sheets and all the cell sheets are right here under the pre-enrollment. When you actually hit that, this on this side, can you tell I'm not an artist? On the right side is going to be those things that you're going to see. So this is the digital supply order form. So this is where you're going to order materials. Right now, they are only sending 10 DSNP out at a time applications, but working harder on that. And you'll actually have to scroll down and you will actually get to a little thing that's got a dot like this, and it will say cell sheets. And that's where you can see all of those different cell sheets. So if you want one for the edge, the compass. So let's talk about that if you had, or the key plan. If you have someone that's on a spend down, and so they're not going to qualify for this, then let's take a look at that zero premium plan. The other reason to put them on that zero premium plan, and I think we've got that coming up, would be as if someone were to lose their full Medicaid benefits. But put them in that zero premium plan, and then there's a lot of things that they're going to have as that zero copay. It could be their primary care visit, that sort of thing. And if they have a spend down and they were to end up in the hospital, that's probably going to trigger that spend down, and Medicaid's going to kick in and help them with that. So agent tools. The virtual really doesn't work that well in our DSNP market, but what really works well with the DSNP market is if you need to have a scope of appointment and you want it telephonically, you're going to call this phone number. That's the 844-927-0563. This is not our customer service number. This is actually, it will be answered by Priority Health, but this is our call center. And you'll have your client on the phone and they'll do that three-way call, and they will actually record that scope of appointment, and then they're going to give you a confirmation number. Please write that confirmation number down because that's going to be your wet signature on that scope of appointment. So then you can talk to them about the plans, about the benefits, that sort of thing. And then if you need that wet signature basically for that application, because you're going to take that application over the phone, you're going to call that number back. Maybe you got a signed scope of appointment, but now that you're talking to them, you need their signature on that application. You can call that number back again, and then you're going to get a confirmation number. If you call them for the Scope of appointment, it generally is, and it's not always, but it is generally the same confirmation number you get for the application as well. So provider network, I think you guys know this already. Priority Health uses one network. We use one network for our HMO point of service, our PPO, and our DSNP. So members have that whole realm of doctors to choose from. They do need to pick a primary care physician, but the nice thing about our DSNP is they do not need to get a referral to see in-network doctors, okay? They only have coverage out of our network for emergency services only, okay? So they don't need to see a Medicaid doctor if they're seeing one of our doctors in our Priority Health Medicare Advantage network. Now, we do have doctors that are Medicare, Medicaid doctors, especially now that the total health care is under the Priority Health banner. So let's talk about how it works. If you have a member that signs up with us, Medicare or our Priority Health DSNP plan is going to be primary. The Medicaid is going to be secondary, and you'll see there's two different places. The Priority Health Medicaid, so when you're going to see an upcoming slide, 7, 8 counties on the west side of Michigan. So in that Grand Rapids area, Kalamazoo area, we have Priority Health has a Medicaid. So it is actually, they're going to have Priority Health Medicaid. Over here on the east side of the state, they're going to have that fee for service. So whichever way they go, they're going to hand both cards and they're going to pay 0 for that service. Okay. So you guys know what that looks like? There is on the left the DSNP card and then that private fee for service Medicaid card. What happens if you are moving someone from Priority Health over to from another carrier to Priority Health? They will have to disenroll with that, and they're going to have that private fee for service because we will not coordinate with any other Medicaid plan. So if you're talking about Medicaid or Molina or some of those others that have their own Medicaid plan, we do not participate with them. So private fee for service or Priority Health, and then the DSNP plan. Okay, grace period. So this is one of the things, if you have a member and for whatever reason they lose their full Medicaid benefits, they have 6 months they can stay on the plan, but you do not want to leave them on there, because what happens is since they've lost the Medicaid, they are basically having, other than having the dental and the vision and that sort of thing, their Medicare goes to basically original Medicare A and B. So they're going to have those 20% copays, and there is no safety net on that Medicare, A and B. So they will immediately get a notice from us within 10 days that we find out from Medicaid that they're not. We're going to send them a letter. We're going to send them a reminder letter 30 days before, but I'm hoping they're going to call you, because this is the point in time, if they don't qualify, that you're going to want to put them in one of those 0 premium plans, one of them that's going to give them much better coverage than original Medicare with the 20% copay. So most of the time, even if they lose their full Medicaid, they're still going to have LIS. But that's the question here, is where they're going to be. So remember, Priority Health doesn't manage Medicaid eligibility. So if they have a question and if they want to argue with you about it, we're going to have to tell them that Priority State of Michigan determines all of this. So they can call the Michigan Department of Health and Human Services. They can talk to their caseworker, although I have heard very bad things about most of the caseworkers don't get back with them. They can call, you can see the Medicaid beneficiary hotline, and then that Michigan enrolls number. One of the reasons I want you to keep this Michigan enrolls number in your mind, and you probably already have it written down, guys, is if one of your members is in Wayne or Macomb County, you can enroll them with any carrier you want, and they are in what's called the demonstration counties. Wayne, and Macomb. And unless they have opted out of Michigan Enrolls, the state is going to auto assign them to a carrier. So you're going to have spent all this time with them. You're going to have enrolled them in a plan, whether it's us or someone else, and Michigan Enrolls is going to come and roll them out. Your member has two options. They can opt out of the current status. So this time around, they would just opt out of Michigan Enrolls auto assigning them, or they can do a permanent one, which says, I want to be able to choose the carrier. So if I want to leave whatever the carrier is and go to Priority Health, I want to stay with Priority Health until I put in an application to go to someone else. Okay, so this is a little misleading because you can see a whole lot of counties over on, where's my cursor? On this side. It's not working. Okay. But these are not all Priority Health Medicaid. What it says is our providers that are in our MAPD provider network, and this one as well, may be part of us, and they also bill Medicaid. So what that means is your member would present their cards and the provider bills both Medicaid and Medicare at the same time, because they do that themselves rather than having, I'm not explaining this well, the Priority Health physician's office is also working with us with Medicaid, which means they bill us once for both the Medicare and the Medicaid. It does not mean they are like those other carriers where it's one card. They're still doing the two cards. So I'm thinking of a lot of the Beaumont employees on this side, the Henry Ford doctors on this side. So if they are a true Henry Ford doctor, they are also a Medicaid doctor as well. So that's where that works. You really don't have to. I'm not that fond of this slide. You don't really have to get into that because your members are not going to remember anything. So just tell them, present both cards. Just you need to know if that doctor currently is with us and a Medicaid provider. It's going to make it paid quicker, but that's just for their benefit, not necessarily your members. Okay. So you guys already know the advantages of a DSNP. It's year-round sales. So someone can enroll just once in every quarter, the first 3 quarters. If it is in the 4th quarter, which we are now in, they basically just have October, November, December, and their enrollment would be on January 1. So they can't make that change during the quarter and have it go the next one. Okay. So customer service online, it's going to be the same as your other enrollments, but the DSNP does have a separate tab to enroll online. When you are going in, sometimes those Medicaid cards only have 8 digits and the system requires 10, so add 2 zeros to the front. We don't recommend emailing them because you don't have a confirmation and it makes it very, very hard to follow up. You can see the DSNP has a separate customer service number and it routes it right to case management, that sort of thing. And the enrollment packs for the DSNP are ordered online just like the others. I think you guys all probably know how to fill out applications. So I can actually see 2 questions. So Linda, you had asked if existing DSNP members get a call to complete an assessment. We are required as soon as they come in new to get that assessment. So existing members, if they roll over, will not have to do a new assessment because they've already been assigned a case management team. And I will, yes, Linda, we will be able to get you a copy of this presentation. I've got it in a PDF format, and so I can get that out as well. Any other questions, since I can actually see the chat, guys?
Can you actually see the chat? Can you hear me okay?
Yep, I can.
I have a couple questions.
Okay.
Let's see, where did they go? Oh, well, you said that it could be a 3-way call with you and the beneficiary for that scope of appointment and also for the other options. Now, can it be on your phone in the event that the beneficiary does not own a phone at that time?
So yes, so you're going to initiate the call. The agent's going to initiate the call
Right.
because basically it's a three-way call because the provider that does this recording for us has to have this information from the member. So yes, you can make that call because they're going to be asking the member their name, their address, their date of birth, their telephone number.
So
And
you
then
could
they're
just
gonna,
be on the call with them is what I mean. You could, that's allowed on the same phone rather.
yes, you can be on the same
Okay.
phone. Good question.
Oh, yeah, and then the other one was, what is your stance and if you recommend spend downs to be placed on this plan?
Spend downs cannot go on the DSNP plan. Cannot, not. This is
Right.
only for full benefit dual eligibles.
Right, and I just wanted to stress that just because
Yep.
I do, I think that's something where brokers don't know where they're going to place that spend down, right? Because maybe that spend down individual qualifies month after month after month. But I usually advise brokers to, look at the 0 MA PD plan, so they're not running into possibly getting kicked off and then going into that 20%.
Yeah, that's just
copay,
devastating
right?
to them when that happens. So yeah, so this, for 2022, depending on where your member is, that key plan has been really beefed up. And for us, the key plan works just like a PPO plan. They don't have to worry about that. They actually have, so they will have copays, but what's nice is both of those plans have a 0 copay for seeing the PCP. So if they're going to see that, both of those, if the member chooses to do like the behavioral health virtual, it's a 0 copay. And the statistics are, almost half of these people are seeing a behavioral health specialist as well.
Or a pain management specialist for sure.
Yes.
Yeah.
Now the pain management, they can't do virtual.
And speaking of specialists, if a member is looking for, we'll say an oncologist or, maybe a specific specialist, who would they reach out to make sure, like, say, for instance, they're not on the network, but Priority or the doctor's shown interest, who does the broker refer the physician's staff to call to try to get on network to help these individuals?
So what you're saying is the member wants to see a doctor that's not currently in our network?
Correct, and it would be a specialist
Okay.
in that arena if that happens, which I've heard, this kind of does occur, right? And then the members are like, well, I don't know, and so just for the brokers to be able to funnel these calls, we don't want to put them to member services, right?
Right. So if the agent wants to contact their sales rep, we can get those too, because that's provider network. And I have to tell you guys, these are not the easiest thing to get through. They take a look and they say, how many members do we have in this particular area? How many providers do we have? It's probably chiropractors that I see on even the regular MAPDs a lot. It's like, well, my chiropractor isn't in your network and he wants to be in there. And they say there's X number of members in this area, and we already have 22 participating chiropractors, which is going to more than account for that. So it does take us they take a look at what's the need in that area. So I'm just going to tell you, it's not like you call me today and I take it to provider network and it happens in a month.
Right,
it definitely,
exactly.
but we need to get those in. If that is a barrier for those members, then we need to get that in.
And we do have another question in the chat. Did you see that? It says, what are the hours for the scope of appointments by phone? I think those are just the same as your member service hours, right? Are those actually going to change for AEP?
They always change for AEP, yes, because they end up being 7 days a week, and they are generally 8 a.m. to 8 p.m.
And that starts basically the 15th through the 7th of December, October, right?
Yep.
All
And they
right.
actually go over a little bit on that, on the scopes and that sort of thing. I'll have to take a look to see. I actually haven't seen when they're opening that up, but they usually open it up just a little before October 15th. Because remember, they're getting those scopes and that sort of thing. They want to see the person on October 15th to sign them up. They're getting those scopes on the 10th and all that sort of thing. So
Exactly. No, yeah. Okay, and then on a side note, so sorry to the attendees that we are just a voice and not visible. This is Yvonne over at Insurance Advisors Direct. But I wanted to let everybody know that I will be, as a thank you for attending and taking this time. I know it's kind of crazy getting ready for AEP. I do have a list of all of the counties, and they're divided by regions for the state of Michigan, particularly, that are in the demonstration project, and then the carriers that are affiliated with that. I also have a script that'll be going out to help any of the brokers to help disenroll or opt out these members from the demonstration project, otherwise known or also known as MMPs. That's when they get auto assigned by the state. I will say individuals in late February is when they start to send out letters to these possible members to get pretty much auto enrolled into those plans. So I do have, you know, a list of those in case you're doing any business in those counties. You know, keep that in mind and know which carriers that they're assigning them to. So for instance, if they are in, we'll just say, you know, a region where AmeriHealth or Meridian or Aetna, some of these plans, Molina, are being auto assigned, at least you have an idea of, if you sign them on the Priority DSNP, what they're gaining on the plan you're writing them on. So you have something to compare it to as opposed to going in blind. But anyway, so I have that, and also the script. And with that, I don't know if we have any other questions. I think it was really good, self-explanatory. I took some screenshots of your nice phone numbers too that I didn't have.
ah, perfect.
Yeah, so that was great. I do like the actual online scope of appointment, but you're right, a lot of them don't have computers, don't have emails. So that telephonic scope is a great option.
Yes, it is. And that works for your regular MAPD plans as well, guys. So it's not just exclusive to DSNP.
Wonderful. Now, is there any chance that we can double up on our 10 kits that we get? You know, but I'm sure you'll take care of us, Connie. In the
Working on
event
that,
that,
the problem was the supply and demand
yes,
to start with. So you need to know, I apparently don't have as much pull as I'd like. I had 10 delivered yesterday. And
I know, so did we. Well, you know, we've been doubling up on our orders, but you know, it's very slow coming, and I totally get it. Everybody's getting bottlenecked right now, but
well,
you
and
know,
the problem that we had was with the printer. So all the materials were printed except the enrollment forms. So the enrollment forms are coming now, but our distribution team can only stuff 1,200 kits per day. So the DSNP kits are there, but they can only stuff, well, and of course we sell 15 times as many MAPDs, so they're stuffing those, so they're limiting us to the 10 on the DSNP right now. So I'm trying really hard. So from what I'm being told, once things lighten up, I'll be able to get a higher amount. We just have to make sure that everybody's got stock to start October 15th, and they're not trying to give everybody the whole AEP's amount of stock.
Right. No,
oh, and by the way, guys, all of the materials are available on that agent center. So you can download, it's all available digitally. Let me see if I get to the agent center. Okay, so when you go to this pre-enrollment MAPD or the pre-enrollment DSNP, the drop down will give you all of the digital materials. So you will have everything right there.
Right. Yeah, we've printed a few
Yep.
just to have, just as, emergency services.
Right, right. But I'm just saying, if you're looking at that going, dang, I got to get there tomorrow and I don't have it, you at least can do one. Um, and then there's always the telephonic option too, if you don't have that enrollment form. Just make sure, guys, because of course, I think you all know that summary of benefits. That's what we're going to get dinged on if you didn't give them that and didn't leave that with them. So just because you do the telephonic scope and you do the telephonic application, you still have to make sure that you get those materials that CMS says we have to, which is that summary of benefits, the star rating, that sort of thing.
Right, right. And that's downloadable and printed because I do see the 2021 summary of benefits is on there, but the 2022 as well. It's
Well,
just very
yeah, the 2022 is there. When we did these screenshots, it wasn't loaded yet, but it is all there
right.
now.
Yeah, I did see that. So it's just yeah, it's a book. So, but again, it's in one of those occasions where if you need it tomorrow, you can have it right off the site. So that's really good to know.
Or 2 o'clock this afternoon. Yeah, we usually get those. It's like, I've got to see you today.
Right, right. Well, that's great. And I think, let's see, it said we do have one more question before we go.
Okay.
Can you tell us a little about people that they have a caregiver, any special requirements or limitations?
Okay, so
I'll let you go first, and then I'll add a little to
okay.
that.
So I'm thinking the question is, do we pay their caregiver? And if that's
probably, I think is that what you're meaning, Nirmana? Yes, yes.
okay, so no, we're not paying a caregiver.
Correct.
So if they're thinking about the Papa Care, that sort of thing, no, we don't. We just don't pay caregivers. That Papa Pal is through a vendor that we use, and we can assure that all of them are certified. So if they're going to use them for transportation, their car is 5 years or newer, that they have current insurance on it, that its tires are adequate, that it's actually above adequate, but the driver has not had any moving violations. So these are all students, college students, or college age students, I should say, that are in the field, a science field. So they're not going to do anything medical, but they are already trained on behavioral health people, physical inabilities and that sort of thing. So we're using those Papa Pals are through a system. We can't add new people to them. They'd actually become employees of Papa. So we don't pay other people.
Right. And just as a side note, when you do run into someone that does have a caregiver, more than likely they're part of that MMP plan.
Yep.
The MMP plans do provide caregivers, and again, it's a give and take. They'll give them that caregiver and they'll pay for that. But now those benefits, whether it's transportation, dental, vision, hearing, that you're getting from Priority's plan is not going to be equal. They're going to get less of that on that MMP. If you do run into someone that does have a caregiver and they're actually utilizing that and helping them, I would advise not to change them. What do you think, Connie?
I agree. I 100% agree, because they are using that unless there's something that's going to supersede that. There's a reason they're using that caregiver and they're on that plan. But probably, so when you're thinking priority, think about the fact of how large our network is, all the hospitals, the not needing referrals. We do have the transportation, the dental, we've got the top notch. We don't have that skinny down Medicaid formulary. We've got the same formulary for all of them. So that's what sets us apart, but it's not a one size fits all, guys.
Right, exactly. So hopefully that helps with some of the brokers that are going to run into some of these caregivers. I do know that there's quite a few that run into them. So
if you're in Wayne and Macomb County, you're going to see those.
Right. And again, just because you can't help that member doesn't mean that they don't have someone in their 360 that you can help. So right. You can always go that way. Yeah. Yep. Well, hopefully we'll go ahead and send out the nice little thank you for everybody spending their time with us. And it's about 12 o'clock. So we did good time, Connie. Excellent. Great. Yeah, it was always a pleasure to hear everything that Priority's got to offer. And again, brokers, thank you so much. Enjoy your weekend. This is Yvonne from IAD. If you have any questions, please give us a call and we'll be here to help.
Thanks, guys.
All right, thank you.